This story appears in the July 2022 issue of Forbes Asia. Subscribe to Forbes Asia. Nadiah had been running TMC Life Sciences for a little over a year when the pandemic hit in early 2020. Virtually overnight, Malaysia's borders slammed shut, cutting off international patients, a lucrative source of income for the Malaysia-listed hospital group, while domestic travel restrictions curtailed appointments and elective surgeries. She quickly reprioritized, juggling ambitious expansion plans with a public health emergency. Now, as COVID-19 recedes, TMC's 38-year-old executive director and group CEO has breathing room to pick up where she left off, to make TMC one of the biggest private hospitals in Southeast Asia. When she spoke by video from Kuala Lumpur in late May, Wan had recently overseen the opening of a new wing in TMC's flagship Thomson Hospital coded to Mansra. The upgrade at the private hospital will triple the bed count to 600 and bolster its range of services, including its world-class fertility treatments, with a new cancer center and more specialist outpatient clinics. That growth will also give a boost to TMC's parent company, the Singapore-based Thomson Medical, which owns 70% of TMC. Thomson Medical, listed in Singapore, is itself controlled by Singapore billionaire Peter Lim. However, she thinks the pandemic did bring a new mindset to the healthcare industry. What COVID did was it made a lot of people in healthcare realize we need to be a lot more adaptive and dynamic, Wan says. Healthcare is a very risk-averse industry, but, with COVID, there was simply no choice, so people had to forge ahead with whatever resources they had. The first few months of the pandemic rattled TMC. Net profit plunged 43% to 13 million ringgit, $3 million, in the 10 months ending in June 2020, the full reporting period for that year. Its fertility business was particularly hit hard by the slowdown in medical tourism. Revenue from international patients, which had made up about 15% of sales before the pandemic, plummeted as COVID-19 led to region-wide travel restrictions and quarantines. TMC has since charted a steady recovery. Patient numbers are returning to pre-pandemic levels as demand for TMC's fertility and hospital services picks up, alongside a growing trickle of medical tourists since Malaysia's borders fully reopened on April 1st. For the first 9 months of the financial year ended in March, net profit rose 9% to 18 million ringgit, year-on-year, on a 17% increase in sales to 173 million ringgit.